Actually, it's not even for patients with chronic Hep C, but it's trying to identify patients who may have it. One of the big problems we're having right now is trying to identify these patients. And we found that the birth cohort of baby boomers, so those born between 1945 and 1965, have the highest prevalence of infection. And now we're starting to see the results of that. Patients have chronic infection for 20 to 30 years. That group tends, over 75% of them will go on to develop cirrhosis. And that's where most of the complications occur with hepatitis C. Increased risk of liver cancer, decompensation of liver disease, hospitalization, and unfortunately death. So we're trying to get the word out that we have really good therapies that are available now with very few side effects, but we're trying to get the primary care audience to identify more of these patients. Even though these guidelines have been out for maybe 3 years or so, we're still not getting the numbers screened that we should as part of patients' regular screening care, as you would for a mammogram or colon cancer screening. So we really want to screen that cohort population for Hep C. So first is screening. We just need to identify those patients more. This has been typically a disease that's been managed by gastroenterology, hepatology, and infectious disease because the treatments that we've had in the past have been fairly complicated with significant side effects that needed to be managed. And they were a little bit tricky to use. Now, with this new generation of what we call DAA, or direct-acting antiviral therapies, there are very few side effects. Most of them are a combination drug, maybe once a day or twice a day for 8 to 12 weeks for most of them, with over 95% clearance of the virus or cure. This is unheard of. We've a chronic viral infection that we can actually cure, not just suppress like most other viruses. So, it's amazing, and we can actually reverse the progression of this disease and prevent people from going on to have complications. Well, it's a blood test, a simple blood test, an HCV antibody test, and it's approved by all the insurers in the federal government. There was a little pushback at first, but there are ICD-10 codes for this that can be used, and it's really just identifying the patients. In the past, we used to say, if you had risk factors, did you ever use IV drugs? Well, most people, whatever they did in the 70s or the 60s, they're not going to own up to now. They may be the mayor of their town or professional folks. That's in their distant past. So we don't really care about that. There may be other risk factors in that birth cohort. All we want to do is say, no, you were born between 1945 and 1965, and you deserve a one-time blood test. If it's positive, then they need to have a confirmatory blood test to see, do they have the infection now, or have they cleared it? And then linkage to care for treatment.